Okay, so hi everyone. Thank you for joining me today. My name is Anjali Prasad. I'm a second year medical student, and I'm going to be facilitating this panel today. I just want to take a minute to thank all my colleagues who have joined me today to introduce all the different health professions that they represent. Obviously, we wish we could have done this in person, but with this whole pandemic, a lot of plans have been disrupted. But we still hope that this panel is going to be fun and informative for you. If you have any questions afterwards, feel free to reach out and we'll direct the questions to the right people so you can get the answers that you need. And without further ado, I'm gonna let my colleagues take over, introduce themselves, what school they're in, what year they are, and we'll go from there. Emily, if you wanna start.
Sure. Hi, y'all. My name is Emily Tranchina. I am a second year medical student at the Long School of Medicine. And that's that for now.
Hi, my name is Ivette Villarreal. I attend UT Health San Antonio in the School of Health Professions, and I am a second year speech language pathology student.
And my name's Kevin. I'm within the School of Health Professions here at UT Health, and I'm a doctor of physical therapy, and I'm in my second year.
Hi, my name is Jennifer Sanchez. I'm in the School of Health Professions, and I'm a second year Doctor of Occupational Therapy student.
Hi, sorry. Hi, I'm Margaret Walsh, and I am a second year PA student, or physician assistant student in the School of Health Professions.
Hi, my name is Leah Wilson, and I am a 7th semester Bachelor's of Nursing student in the School of Nursing here at UT Health.
Thank you guys all for joining us. I guess we'll start off with the very first question, which I'm sure is going to be the first thing anybody thinks of when they hear any of these professions is, what is your role in patient care and how do you work in the healthcare team? Because as we know, medical care is super interprofessional. It requires everyone's participation to make sure that the patient gets the best care.
So we haven't really had the opportunity to practice medicine for real, or at least I haven't. And the way that I understand the role of the physician is to kind of be the quarterback of the team. So the patient is going to present to me, and then I'm going to direct them to the person who I think has the best ability to take care of them. So if they've got a speech disorder, send them to a speech language pathologist. And then in hearing back from everybody who was a part of that team and collaborating and saying, hey, we all really want what's best for them. Go this way, go that way.
And as a speech language pathologist, my role in patient care involves assessing and treating speech, cognition, and swallowing across the lifespan. We are an allied health profession, and you can typically find us working side by side with the rehab team, with PT and OT. And so doctors will refer patients to us to evaluate their speech, memory, attention, swallowing, problem solving. So our first step would be to administer an evaluation to get a baseline and determine what the patient will benefit from. From there, we will typically talk with the rehab team and come together to see what the plan of care will be for the patient.
Yeah, and then as far as physical therapy is concerned, we're really focused on motion and movement and a person's capacity to perform, the tasks of daily life. And so it could be returning back to a sport or in a more acute care setting, that'd be like in a hospital. We're working more in collaboration with the other healthcare professionals. And in that setting, it's different types of goals. So they're not trying to get back to a sport. It's, can they walk down a hall? Can they, sit up in the bed? Can they, get back to walking?
Yes, and the role for occupational therapy is to provide practical support to empower people to ease recovery and overcome barriers preventing them from doing the activities or occupations that matter to them. And I'm not sure if y'all know what occupations mean, but in the OT world, that just means anything that occupies your time, such as sleeping, walking, eating, any of that. So if I refer to that in the near future, now y'all know what I mean. Oh, and sorry. And then we also work in the team, the rehab team, like everyone mentioned. And I think it's just important to know that like the healthcare team's goal is to deliver the highest quality of care for the patient.
So as a physician assistant, we basically work alongside of a doctor. Our license has to be underneath a medical doctor. We can also see all of our own patients. We can refer, we can diagnose, we can treat, we can write prescriptions. Yeah, so like Emily was saying, you get a patient presented to you and then you, like the medical doctor is the quarterback, we're their support throughout the whole process.
So as a nurse, our role is primarily the actual care of the patient. We are the reason you're in the hospital is so that you don't go to the hospital to see the doctor. You primarily go to the hospital for nursing care. So we're the ones who are making sure that you are safe. We're the ones who are making sure that you get the actual treatments that you're supposed to get. We give you your medicines and make sure that the doses and the ways that they're being given to you are proper and won't hurt you. We make sure that you are doing things like range of motion exercises, or helping you get up and walk so that you can continue to recover and improve. If you are a patient who can't move, we move you so that your skin doesn't break down, and we are constantly assessing you to make sure that things are improving and not getting worse. If they are getting worse, that's our job, is to notify the physician immediately so we can change things. One of our biggest roles is patient education. So we are constantly educating patients on what we're doing and why we're doing it so that they know when they go back home what they need to be doing. We also are patient advocates. It's our job to advocate for you to the rest of the healthcare team. So if the doctor is doing something that you don't agree with, and we know you don't agree with it, it is our job to stand up for you and say, hey, this is not what the patient wants. And that's true for very much at the basic level, at the registered nurse level. But you can go on into advanced practice nursing and go all the way up to having a doctorate of nursing practice. And then you're working in a similar role as the physician, as a physician's assistant, having prescriptive privileges, taking care of patients in a primary care capacity. So nursing is actually a very broad profession and functions very interprofessionally with all the other professions.